from Team IAP Mumbai to this yet another episode of IAP Mumbai Monthly Connect, Zaraa Hatke, Zaraa Bachke. So, as all of us know, that this is an online monthly program that happens on the second Wednesday of each month, 9 p.m. onwards. And it relates to topics which are not very uncommon. They're seemingly very simple and common, but yet when it comes to management and looking at the various aspects, it is always a dilemma. It's always a perplexed situation to a lot of pediatricians in office general practice. And this is the brainchild of Samir Dalwai sir, and he's come out with these very uncommon things in a way which always pose a problem to pediatricians when it comes to actual management. So today again we have a similar kind of a session, something which is not very common, but of course something which is not uncommon as well, because most of these cases are now surfacing out to us. And gender identity disorders are really shaping up in everybody's practice, as some sees once in a while. So today's session is going to be on such one topic out of the box, beyond the binary, understanding the gender spectrum. And like always, we have a flurry of experts talking on this topic from all over, and I welcome these all dignitaries, Dr. Harish Pemde sir, Dr. Preeti Galagali madam, Dr. Armaan Pandey sir. And with us, we have two excellent moderators. We have Dr. Samir Dalwai sir, our own very much IAP Mumbai person who is extremely good, a neurodevelopmental pediatrician, and in fact, overall a very good orator who takes it. And with him co-moderating the session today is Dr. Amruta Shirodkar. She is ex-treasurer IAP Mumbai 2022-23, and she's our current EB member and also an adolescent expert. So without much delay, I hand over now to Dr. Samir Dalwai to please go ahead and welcome all our experts and introduce our dignitaries today. Thank you so much, everybody.
Thank you, Dr. Nehal. Dr. Amruta, you can begin.
Sure. Yeah, thank you, Dr. Nehal. So I think as pediatricians, we have the privilege of accompanying young people through some of the most formative years of their life. And interestingly, we encounter sometimes children and adolescents who express questions, thoughts, or even discomfort about their gender identity. For some, it might just be a transient exploration, but for some, it may reflect a deeper and a more persistent experience of a gender dysphoria. Now, we all know it's a recognized medical and a psychological experience that can significantly impact a young person's mental health, self-esteem, and well-being. So we need early recognition, we need appropriate support, and a non-judgmental approach which can make a profound difference in their journey. So to discuss this very sensitive topic, today we have a galaxy of experts with us. And today we have an expert outside the Indian Academy of Pediatrics, and it's my honor to welcome and introduce Dr. Armaan Pandey. Dr. Armaan Pandey is a Mumbai-based consultant, psychiatrist, and a schema therapist in private practice. He's an alumnus of the Lokmanya Tilak Medical College and Hospital, and he's also the founder of Sexuality Matters, a comprehensive sexual education platform. He has the experience of helping hundreds of trans persons and others from the queer community. He has spoken on several national forums and conferences on similar topics. Apart from this, he has been twice a speaker on the TEDx. So it's my really honor and privilege to welcome him today to this exclusive Zaraa Hatke, Zaraa Bachke session. Along with that, we have other two experts who are stalwarts and pioneers in the field of adolescent medicine. I would like to request Dr. Samir Dalwai sir to introduce them and commence the session ahead.
Thank you, Dr. Amruta, and thanks, Dr. Nehal. All thanks to all the seniors and office bearers of IAP Mumbai for this wonderful platform. And thanks to all the wonderful seniors. I was seeing the people who are attending as delegates today. It's really an honor. And now it's my privilege to welcome somebody we cannot call a guest, but he is an expert because he's part of our own IAP. And that's none other than my dear friend, Dr. Harish Pemde, sir. Dr. Pemde sir is a director, professor of pediatrics, medical superintendent, Kalavati Saran Children's Hospital, New Delhi. He's in charge of adolescent health and is the head of the pediatrics medicine unit at Lady Hardinge Medical College, New Delhi. WHO fellow, clinical epidemiology and biostatistics, as well as Adolescent Health University, Melbourne. Chairperson of IAP Medical Education Chapter 2024, but very significantly also Vice President, the Indian Academy of Pediatrics North Zone 2025. Vice President, International Association of Adolescent Health, member of International Pediatrics Association Program Advisor to Nationwide Quality of Care Network, an author of Clinical and Practical Pediatrics, second edition and third now edition coming in, editor-in-chief, and author of many publications, books, and we are going to share some with you today itself. And more than everything else, such a wonderful teacher, such a wonderful, pleasant person, and I've had the pleasure of working with him in the EB when he was the joint secretary as well. It's always a pleasure to have you, Harish bhai. Welcome. Please
Thank
put it
you.
together for Harish. Uh, the other expert we have today is equally well known, and very coincidentally, we have both the vice presidents today, and that's none other my dear friend Dr. Preeti Galagali, who's known across the country as a consultant adolescent health specialist and pediatrician. She's a director of Bangalore Adolescent Care and Counseling Center, clinical lead adolescent clinic at Manipal Hospital again in Bangalore, and as we said, currently vice president South Zone Indian Academy of Pediatrics. She's also a very well-known international figure, Vice President Southeast Asia International Association for Adolescent Health, co-chairperson of the Education Committee, co-chairperson of their Scientific Committee of the World Congress Adolescent Health, Secretary International Chapter Society for Adolescent Health, and multiple organizations, including the International Pediatric Association. But achievements really more than 200 scientific talks, more than 100 scientific publications, multiple orations, endowment lectures, and thousands and thousands of community programs. I can go on and on, but I'm sure I'd rather give that much time to them to speak. So, with again, ladies and gentlemen, please welcome Dr. Preeti. She's going to be the who's going to present the pediatrician's point of view towards the end. So, having said this, let's come back to the topic right now, and we are going to begin with the way the webinar works, in which we ask questions to our experts. Before we begin, let us please understand that as Dr. Nehal explained, these are topics Zara Hatke, Zara Bachke. They are not really something within our day-to-day perspective. And the reason for that also is the fact that sometimes some topics end up making us a little uncomfortable. I mean, we won't say that about malaria or typhoid, but we definitely would say that about this topic because we certainly have been brainwashed or brought up to be thinking in a particular way, and whatever does not get fit correctly into the mindset that our mind has been projected or programmed to have, we find that a little difficult to deal with, and that is why all the more that we need to make a concerted effort to try and understand, because eventually it is the light that dispels the shadows of uncertainty and darkness. Because beyond this darkness, there are so many wonderful human beings, children, adolescents, adults, who continue to suffer behind a so-called iron curtain or in this darkness. And it is the duty of each one of us who considers ourselves learned, educated, a doctor or a scientist, to be able to explore all these topics. With this, I would like to now begin by asking dear Dr. Harish sir, uh, to begin with, the terms that pediatricians are always confused about are terms like gender identity, gender expression, biological sex. So, what are the meanings of these terms, sir? And what are the key differences that pediatricians should keep in mind about these terms, whether it is gender identity, gender expression, and biological sex?
Thanks, Dr. Samir and Mumbai IAP for giving this opportunity to talk about this topic, which is rather less well understood and often confusing for us. And most of us will find difficult to deal when a child comes with these issues. So we have Dr. Armaan Pandey. Probably he is much more experienced than us in dealing with such topics. And I'm just a kind of a disclaimer that my terminology for may not be very friendly to this community. So I beg your pardon in the beginning. But let us talk for pediatricians. So there are few terms which we should understand very clearly. One is the sex assigned at birth or gender assigned at birth. We all pediatricians have to do it when you deal with newborn baby in the labor room or in the OT. You have to write whether this is a male or a female child. Okay, as a pediatrician, as a neonatologist, or as a resident. And almost always you will assign by looking at the genitalia of this baby, whether this is a male or this is a female. Sometimes we find it difficult. Maybe there is an intersex-like situation is there. We cannot identify whether this is genitalia is a male one or a female one, and we write intersex or something else. But in most cases, almost always, we assign female or a female. So this is a sex assigned at birth or gender assigned at birth. So this is very clear. Okay. So this gender or sex is given by someone, by a pediatrician, for example, or by a nurse, or by community, or by parent. So we all collectively say this is a boy or this is a girl. Sometimes we get confused, so we'll do it later on, but mostly it is like this. This is one terminology. So some identity given by other people, not by the individual himself or herself or itself. Okay. Now what is gender? Gender is determined by the individual. I will say who am I, or the other person will say who the person is. Whether I identify myself as a boy or as a male or other. For example, Dr. Preeti identify herself as a female. So when these two things match, so sex assigned at birth is male, I myself declare and identify myself as a male, then there is a matching is there. Okay, so this is known as cisgender. So your sex assigned at birth and gender given by the individual are matching. Okay, now the little complicated part of it. Sometimes you find that this is not matching. So an individual who was assigned sex at birth was male, and when child grows up, the child begins feeling that I am not male, I am a female. Okay. When you grow up, adolescence or adult, then you find that you are not a male, you are a female. So this incongruence is there. Okay. And this incongruence is reflected in your behaviors, the way you talk, the way you dress up, the way you play with toys during early age, or the way you behave like those stereotypical behavior of a male or a stereotypical behavior of a female. Okay. So when your expression of this feeling, this is gender expression. Okay. So gender is you feel inside, this is a gender, and many a times you collect the courage, then you declare and come out of it. Then you say, although my assigned sex at birth was male, but I am not male, I am female. So this is considered coming out of it. Okay. So these individuals collectively called transgender. Okay. So this is the gender identity. Gender identity is given by the individual and declared by the individual. You cannot presume the gender identity. You have to ask the person. If you see my name here, so I have written my pronouns.
Yeah, can you please mute everybody? Host. Yeah, please go on, Harish sir.
Okay, so I have written my pronouns. So I am declaring that I feel like a male. So my pronouns are he, his, him. So one cannot assume from my appearance who am I. I have to declare it. So this is the difference between sex assigned at birth and gender. And accordingly, when I express myself as male, I would wear clothes which are decided by the community and society like a male. I talk like a male. These are stereotypical behaviors. Okay. If I feel like a female, I will wear clothes like that. Similar behavior is reflected in early childhood also. We know how boys play, how boys like things, how girls play, how girls like things. How they dress, a boy would like to dress, how a girl would like to dress. When these things vary or vary from the sex assigned at birth, then we can identify that gender identity may be different than the sex assigned at birth. And these things can be identified early in life, means about 6, 7, 8 years, and certainly almost always before puberty.
Okay.
Right. So gender identity can be identified before puberty. And gender expression, how do we identify gender identity? Because when person is not telling himself or herself or itself, by their behaviors. Okay, the choice of clothes, choice of talk, choice of play in young child, and choice of other routine behaviors, choice of the toilets, and your feeling whether you like your body, you don't like your body. So all these things are collectively reflected in the gender expression.
Okay. All
So
right.
these things are clear now, I think. Another thing which people get confused is sexual orientation. So what are your romantic feelings? These things come out around puberty and after that only. So whom you feel attracted to? Okay, if your uh, gender is a male, if you feel attracted to a female, this is heterosexual behavior, right? If you are a male feeling attracted to a male person, this is a homosexual behavior. So what I have described till now is a binary things, either this or that. But life is not cannot be described in binary. There are many things in between and outside these two things also. But to begin with, let us describe like this and go ahead in the webinar, and we'll explain other terms also as we go about.
All right.
Okay.
Wonderful. Very, very nicely said, Dr. Harish Bhai. And I mean, very complicated topic, but you've explained what is gender identity, gender expression, biological sex, and also you just touched upon orientation. So we'll come back to that. But what is this term that we keep hearing, gender dysphoria, and what does it include? So quickly, if you can give us that answer.
See, gender dysphoria is a kind of an anxiety disorder, you can say. Okay. So gender dysphoria develops when person gets stressed because of the gender. How? So if a boy, like 7, 8 year, 10-year-old boy, he starts wearing sari and girl-like clothes, applying lipstick, playing with girl toys mainly. So his gender expression becomes like a female. Okay, that time family does not tolerate usually. Society does not tolerate usually. Okay, school and friends do not tolerate this thing behavior. I mean, they will do some kind of a stalking, some kind of a name calling. Some discrimination starts at home and outside also. So any discrimination based on anything to anyone will make the person anxious. Okay, when this increases much more, this is called dysphoria. Gender dysphoria is so that extreme anxiety because of gender. Okay, so this is gender dysphoria, and it can vary from mild to moderate to very severe, and various grades may be there. Some diagnostic criteria are also there. But anything, anxiety-like situation happening because of gender is gender dysphoria.
Correct. So basically, any kind of anxiety that comes because the individual is not able to be very clear about all this leads to anxiety. Dr. Amruta, would you like to go ahead and bring in our other guest, Dr. Armaan?
Yes, Samir sir. So, Dr. Armaan, many a times I just want to know that what are the early signs or behaviors that might indicate that the child or the adolescent is experiencing gender dysphoria? For example, we have sometimes a 10-year-old patient who's like assigned male at birth, but is interested in wearing female dresses, playing with dolls. Should we see this behavior as normal, abnormal, transient? How do we differentiate?
Yes. Hello, everyone. I'm Dr. Armaan Pandey. I identify as male, prefer pronouns he, him. I'm going to follow what Dr. Harish said earlier. This is something that we take for granted, most of us, that gender is going to match the sex that we express. Um, you know, but yes, we are here to make a difference as clinicians, to be present and to help our patients, like Dr. Samir said earlier. I actually would like to start with the last question. I mean, the question before this about gender dysphoria. I want to make this correction since I'm the psychiatrist here. Gender dysphoria is not an anxiety disorder. Anxiety disorders are absolutely different. Dysphoria is a very unique feeling. It's not like anxiety. Anxiety is something that all of us are familiar with. Dysphoria is something that most of us here have never experienced. Now, all of you, whoever has their screens on, I can see that you appear a certain way. And just by looking at you, I can assume your sex and probably the gender that you feel comfortable in. Now, imagine if I asked you to wear cross-sex clothes. you have to wear cross-gender clothes and come to a social platform. What you're going to feel is not anxiety. What you're going to feel is very close to shame. And this is very close to dysphoria. This is, again, not exactly dysphoria, but this is something that a person with gender dysphoria feels day in and out. So there are two main criteria that I'm going to just let everyone know, since everyone is a clinician here and you deal with children and adolescents, two main criteria that make gender dysphoria set apart. At least for a period of 6 months, the person experiences preferences for the other sex, like preferences to appear or be addressed like the other sex or other gender, if we are thinking in binary terms again. And second, very, very important, gender dysphoria means that the person is very uncomfortable. The person is extremely uncomfortable with their anatomical sex, and there's a desire to change the anatomical sex. So it's not just that, I like to wear feminine clothes. I don't like any of my primary or secondary masculine characters, sexual characters, and I want to change them. So these two features distinguish gender dysphoria from a lot of other things. So with that background, now I can answer, Dr. Amruta, your question about whether this child who's growing up, is this normal or abnormal?
Just one second. Amruta, who's the host? Please mute everybody. Absolutely. And if people unmute themselves, then delete them from the group. So sorry, Dr. Armaan. I beg your pardon.
Yes. So in one word, it is a normal behavior, because barring the conditions that were described earlier when we determine sex, barring the genetic and endocrinological problems that influence someone's sexual development, which are usually congenital, and we come to see problems with that. Barring that, everything that develops about human sexuality is normal, whether it's sexual orientation, whether it's gender identity. So, again, to just refine what Dr. Harish had said earlier, as a child's brain is developing, up until 3 to 4 years of age, the child sees gender norms around them, basically in their environment, that my father is like this, my mother is like this, my uncle, my aunt, my sister, brother, whoever. And their brain is, liking and disliking certain gender norms. Let's say that there are 10 gender norms of masculinity. Out of those, 8 are some things that I like. 2 I don't like. There are 2 gender norms in feminine side that I like. So this is my gender identity. It's very unique to me. And all of our gender identity is on a spectrum, to one side or the other. So this child who's growing up, assigned male at birth, shows preferences for, dolls or feminine appearance or something like that. The gender identity is normal because the brain is normal. Now you would say the body is also normal. It's developing like a regular male body. So there's nothing pathological about the body. There's nothing pathological about the brain. The problem is the mismatch, and the mismatch leads to the criteria for dysphoria, the extremely distressing feeling, which is not normal, which is not something that a person should live with. And that's what we treat. That's what we help a person get rid of. So I think I answered your question, Dr. Amruta.
Yes, very nicely answered, Dr. Armaan. I think it is very clear
Thank
now
you.
that when we should take it as normal, as transient, and when we should consider this could be some permanent thing which the child is feeling. Excellent. Sir, should I take the next question? Yeah, so the next question I would like to ask Dr. Pemde, sir. Sir, suppose a patient turns up at our clinic with certain gender-related concerns or identity exploration. Are there any specific things we document in our notes? And are there any medical legal issues also involved in such documentation?
Yes, as Dr. Armaan said, these things are normal, not pathological. Okay, but because of the societal expectations, societal, you can say, stigmas, these things are very, very difficult things to answer. As Dr. Preeti is also here, we have IAP has got some guidelines on adolescent-friendly practices. Sorry. So whatever we document in our files, it is confidential actually. Okay. Anything which we feel may harm the child in any form is confidential. So whatever patients have made the paper, OPD slip or whatever slip you want, if they have written male, keep it male. If they have written female, then keep it female. This doesn't harm actually. But you internally in your internal notes, you know what you are dealing with. So having a separate documentation is not the goal of your care. Your goal of care is helping the child, helping the family, right? So yes, medical legal issues may come because they have different medical legal rights. Some acts are also there, but this documentation should not be a problem. This is our own document, which is confidential. Okay, unless it is, unless you have to breach this confidentiality for the benefit of the child, those are very different things. So no issues about documentation part. What was the next question? Second part of it?
So in fact, the next question we'd like to come to is what are the medical legal issues associated with whatever we document, because at the end of the day we have to be worried about it. So either yourself, Dr. Armaan, whoever has can word with that.
See, documentation in the file, we document what concerns the child has or what concerns the parents have, as we document presenting complaints. So you document the concerns, what they are having, whether they are concerned with the behavior of the child, which they are still not accepting, okay, or they say the some features of gender dysphoria are there, okay. You have to document all those things, and your head's history when you take home education and sexuality also, you can document these things. There's gender expression of this patient appears to be like a boy, but sex assigned at birth was a girl. So you are just documenting the findings. We may not conclude what it is, okay, because this is a normal thing.
True.
Then depending on the act, and some act is also there which defines very well the rights and responsibilities, and many other things are there. So that comes mainly later part of it. But first part is our duty is to manage the patient, help the child, help the family. So whatever complaints are there, we have to deal with it. And pediatricians should have at least one goal. That is the most important thing, to get the or prepare the parents to accept the child as it is a normal child. This is the biggest goal of pediatricians. If we can achieve this thing, this is half the battle won.
Correct. Or at least this is a challenge that we should accept.
I've talked to several trans people. Many of them are doctors also. And their concern is that we should get accepted at home. That is what we want. Nothing more than that. Others, we will deal with them. But we have difficulty in dealing with parents.
So, sir, we are going to come to the navigating the parents in a bit. We are jumping a little bit ahead of ourselves right now. So we'll come to that part. Before we go ahead, sorry to interrupt you on that, sir, but just before we go ahead again, Dr. Armaan, have you had any encounters where maybe then the parents come back and they kind of threaten the doctor that you've written something like this, how dare you write it, I will sue you, etc. Has that happened? Does that happen?
Actually, yes, I had one plan, but most of my patients have been adults. So, with adults, there is no problem because they can give consent and it's confidential between me and the parents. Of course, with children, like Dr. Harish said, it's all about patient management, and whatever you see, whatever you find, you have to document that, nothing beyond that. But yeah, I did, after 2-3 years of seeing that patient, the parents, not just the parents, but they got some political goons along with them. All of them appeared in my clinic, and they had some, photograph of my old prescription where the diagnosis was there, and they're like, "Oh, my daughter is now behaving like a man. She's looking like a man, and I've not even seen the patient for 3-4 years. And you have done this," and they threatened, and a lot of ruckus was created. So yeah, that was one this thing I faced, but the police was very helpful. I next day went to the cops and told them about this. They were very, very helpful. We are never in the wrong when we are, keeping the patient in the center. We have to do our work. There's nothing different as far as gender dysphoria is concerned or people expressing gender incongruence is concerned. There's nothing different that we have to do as clinicians. Sex is sex, right? We document the sex. You don't want to document the gender, you don't have to document. It's not mandatory. But everything else is as it is. The chief complaints, the ODP, the examination, all of them are same. Okay.
All right. So as long as you've understood these terminologies, what we described today and what especially Dr. Harish started in the beginning, as long as we've understood it clearly, I think we are pretty safe. So quickly, how do you differentiate now that this person is undergoing gender dysphoria related issues or other psychological conditions like body dysmorphic disorder or depression even in adolescents?
Right. So these are different illnesses with different diagnostic criteria. Body dysmorphic disorder is, focused on a very specific body part, and it's generally not relevant to gender. It's not about masculine or feminine. It doesn't make me look masculine or feminine. Like I'm obsessed with my hair. So, no matter how much hair transplant I get, I still feel like I'm balding. That is body dysmorphic disorder. Or my nose, it's just big. No matter how many nose jobs I get, that is body dysmorphic disorder. Very rarely it is for the entire body. In gender dysphoria, it is not about the appearance of a single body part. It is about the gender that it expresses to the individual and to people around. Depression, of course, depression is very, very common in children, adolescents, and the diagnostic criteria are very different. It's a whole syndrome of different symptoms, change in behavior, change in mood, change in physiological things like sleep, appetite, in older people, even libido. So all of those things are very different. Depression is a very clear cut, sudden change in a person's mental health. Gender dysphoria is there as soon as the incongruence develop. Like Dr. Harish said, the child is developing, thinks that whatever is happening in their mind and their brain is completely fine. And then the world starts telling them, no, this is wrong. You're supposed to wear these kind of clothes. You're supposed to behave like this. That's when the incongruence develops. The WHO diagnosis is gender incongruence. Gender dysphoria is by the American Psychiatric Association, by DSM-5-TR. So gender incongruence is a better umbrella term. This starts developing right from childhood, especially during puberty and definitely in adulthood. So that's chronic. And it never changes. It never goes away until a person actually undergoes transition.
All right. So thanks a lot. I'm just going to ask some questions. Please pardon my ignorance. Absolutely. Now, for example, there is a parent who comes and tells you that my child has been a male child identified by everybody has been dressing up like a girl. Then I don't know whether you've seen this Bombay Talkies, a 4-film anthology made about 10 years back, in the which there was one film in which Ranveer Shore, the father, comes home and finds that his son likes to look at an imaginary Katrina Kaif and wants to dress up like her and wants to become a dancer, etc. Now, how do you proceed with this? So, is this a transient thing that there is kind of an exploration or experimentation? When do you begin to think that no, this is more serious than just exploration? I mean, somebody could be taking a part in a play in the school and he's dressed up, he's playing the part of a girl. So, maybe he's doing that at home as well. So, how do you navigate this conundrum? Yeah.
Shall I take that question or Dr.
Yeah, yeah.
Okay. Okay, let me begin with it. Samir, if you remember, you live in Bombay. Earlier films, movies, talkies, the
Exactly.
females were not allowed to act in movies. Only the males
Yes.
were acting like a female. But they were not having any gender dysphoria. They knew very well that we are just acting. Okay, so you see the Kapil Sharma show. There are many
Yeah.
actors who dress like a woman. This is not the thing. Actually, no one behavior can decide. You have to see the spectrum of behavior, its persistence of behaviors, and from childhood to adulthood, sometimes only in adulthood, but only one time or one behavior will not lead to the diagnosis. When this is persisting and feeling, when child is grown up, we can talk to them, how do you feel like it? Okay, so that is how we make the diagnosis. Occasional wearing is not the diagnosis. This is one thing. And Dr. Armaan said that this never changes actually. Okay, once this type of behavior is established, and when the transgender behaviors are established or are going on, it doesn't change actually. This is kind of a permanent but normal but permanent thing. This is very, very important to understand and to explain to the parents, because many people believe in conversion therapy. We go here, we go to there, to some Baba or some deity or some other thing, then this will change, this treatment or that treatment. This is not going to change actually. Okay, because of fear at home and fear in society, people can hide it. because they may not have enough courage to express. So they come out at a very late age sometimes, okay, about it. But this begins in childhood and it persists.
So again, before Dr. Armaan you answer, Dr. Anaita has asked, what is the age limit after which cross-dressing like behavior should be taken as significant issue? And also, Dr. Shefali, any particular age up to which these transient behaviors of liking opposite gender norms are considered normal?
See, very young
Opposite gender
children
norms.
living with other sisters, all are behaving like same. Sometimes very young children, you can say, but consistently you feel that child and more than one behaviors are like of the other sex and is persisting for a long time. I can't give any age limit that beyond which this cross dressing is normal or before which cross dressing is normal. So not one thing, I don't think it can be given about this permanent sex affirmation treatments. By law, we cannot do it before 18 years of age. 18 years because the time to give consent by the self is cut off age 18 years only. This is a medical legal point. Before that, permanent affirmation things are not done as the law says. But her concern is after 18 is too late. Yes, this is right. After 18 is too late. And let me tell you, I met one trans woman. Sex assigned at birth was a male, and then it turned out to be a transgender trans woman. I met that girl in Australia, and that girl was very angry with pediatrician because pediatrician did not recognize before puberty. If it is recognized before puberty, then many things can be done. You can change the body, you cannot change your beard and mustaches, you cannot change your voice. So for these things, that woman was very angry with pediatrician. So definitely treatment begins in before puberty also. But permanent kind of a treatment is possible after 18 years only because of medical
We'll come to the treatment part in a bit. But again, Dr. Armaan, any points about age limit or something like that?
Okay, see, again, no medical body or scientific body in the world has ever defined that a person needs to like these particular kind of clothes only. So whatever everyone is thinking here, saying here, or anyone else outside is thinking that this is medically abnormal, they are wrong. This is not so. No medical body in the world has said that a person who's born as a male or has been assigned as a male only can wear these clothes. These are social norms. And whatever we are saying, I'm seeing a lot of people saying that how can this be normal? So you're thinking about it from a very human perspective, from a cultural perspective, a societal perspective. But as a doctor, I mean, any clinician, as we were learning also, as we were growing up also, we learn primary sexual characters, we learn secondary sexual characters. None of them mention that, we have to wear certain kinds of clothes. These are gender norms. These are not biological things. All right. So again, I don't want to make it too complicated because then I'll have to talk about what is identity in the first place and then how gender identity is part of that. I'm not going to make it too complicated. Asset psychiatry is quite complex to understand for most of us here, including me. So exploration, as far as exploration is concerned, see, it is cultural, absolutely cultural. In ancient India, gender was not a noun, gender was a verb. We have the example of Arjun, who lived in exile for a year or more as a woman. We have so many examples. Shikandi, for example, born as a male but identified as female, fought as a transgender. Ardhanarishwar, these are temples that are dedicated to gods. We have deities where gender is not binary. So gender has always been a thing that human beings have explored. Now, civilization, culture, our societal norms, they limit our avenues of exploration. When I was growing up, boys could have long hair. Now I see more and more boys having long hair. When I was growing up, few boys had long hair, and they would be mocked. Now I see that most teenage boys have long hair. So how much a person can explore their gender expression changes from time to time, culture to culture. And there's nothing medically wrong there. That's all that I would like to say to all the doctors here.
All right. Thank you, Dr. Amruta. Dr. Amruta, you want to go ahead?
Yes, sir. So, sir, I think Pemde sir has been talking about that the most important things the parents need to do is to accept the child. But, sir, many a times we know that the parents are going to be unsupportive, they are going to be hesitant. So, are there any smooth ways in which we can navigate this conversation with them? I mean, any way in which the conversation can go smoothly, or anything which you suggest?
This is the skill we have to learn. Okay, and by experience you learn these things. These are counseling skills, how to make parents comfortable, how to make our client comfortable, right? Like heads approach, you begin talking about home education activity, from non sensitive topics to the sensitive topics. Okay, the way you talk, the way you make the person comfortable, the way you provide audio and visual privacy, the way
Right.
you explain confidentiality criteria, all these things are very, very important.
Right,
And
right, sir.
time consuming also. So you have to keep patience. In one sitting and one encounter, the child will not open to you. Okay,
Absolutely.
because
So many.
you are asking for something which child is not comfortable talking to even parents
Right,
or
sir.
friends. So child must have absolute faith in you, then only they will talk. And this is our experience that this takes 2, 3, 4 sessions, then children they open up.
Right, sir. Right. And
So
many
this
a
is a
times,
whole
sir, you
process
already
you have to learn.
discussed about the myths, like they
Similar
feel.
is for parents.
Right,
You
sir.
have to instill faith in you, in the parents, the way you manage your patient, the way you talk to them, and the way your popularity or your kind of image is there in society. So all these things are important.
Right, sir. Right.
Right.
So also you also touched upon that they have a myth that this can be we can try conversion therapy. So there are there any other myths which the parents harbor
See,
regarding
I
this?
have one similarity. Like Samir Bhai is expert in autism. Similar thing happened with autism. They want to cure it. For
Right.
example, early cerebral palsy, asphyxia with asphyxia sequelae. People go doctor shopping. Maybe some kind of a magic can happen. So
Right.
similar is for this also. Okay, but it is us who have to tell them good prognosis or instill the faith that this is perfectly normal as far as the body and mind are concerned. Only thing is that the software in the mind is little different than the other children they have. The
Fair
way
enough.
you tell them,
Yeah.
the way you instill the confidence, the earlier you do it, earlier they understand this is good for the child and the family.
Fair enough.
Right. Right. Very well explained.
Dr. Armaan,
And
what is
also, I
your
would like to add that conversion therapy, that means trying to convert the gender or sexual orientation of a person, gender identity and sexual orientation is illegal in our country. India
Yes,
has passed the law. Conversion therapy of any kind is
is
illegal.
illegal.
And of course, it is unscientific, doesn't lead to any benefits.
Right. Right.
say that again? Say that again clearly.
Conversion therapy, that means trying to convert the gender identity of a person to match their assigned sex or the sexual orientation of a person. This is banned. It's illegal in our country. And it is also unscientific because it does not lead to any medical benefits.
Absolutely. So what you're saying is obviously people have come to you and told you that this is what my child seems to be having. Why don't you try and counsel him to get? So how often is that? How often do you get parents thinking, "Ye kya ho raha hai isko? He's just influenced by some Bollywood or watching somebody on some role model, etc." Why don't you talk to him, doctor, and get him to get rid of this thing?
Yeah.
And how do you
See, this is
counsel the parent? And secondly, what do you do? How do you evaluate? What are your next steps?
this is
Samir,
a very
sorry, Armaan, before he answers, let me tell you one experience. Okay, one very senior pediatrician told me in a kind of a conference where some trans people were participating. He said, "This is just a fashion. The boys with beard and mustache, they wear saris and come to the conferences. This is nothing but a fashion." So if very experienced senior pediatrician can feel like this after going through several similar sessions, so it is very, very difficult to change minds. Okay, so this difficulty we are also facing, but we have to change for good thing. Sorry, Armaan, you can answer now.
Sorry, no, sir, no, sir, no. Absolutely fine. And exactly what Dr. Samir said earlier, certain topics stirs something personal in all of us. We all relate to this. Gender is not a domain only for the transgender. It is applicable to all of us. So we have to question our own gender identity sometimes, and that some people can feel uncomfortable about it. With parents, though, when a child comes out to them and tells them that, hey, my gender identity is different from what you've been thinking, parents typically go through a grief reaction because they've been thinking that, hey, this is my child, this is their life. And now the person says that, no, I'm somebody else. So first they have to let go of this image, and the brain processes this very closely to losing a child. So they go through the phases of shock and denial, anger, bargaining, depression, and finally acceptance. So this is a normal parental reaction. We should not, pathologize that, and we should not become against parents or, say that they are overreacting or they're not supporting the child. They are also humans and they're allowed to have their human reactions. We support them through that. We help them go through all the phases of that grief without complicating things and keeping the, central person, the patient's health in our focus. So yeah, there are, of course, it's a long process. Dr. Harish said earlier also, it takes quite a few sessions, and our own faith in the treatment part. When we say that, yes, this child is going to have a great life, if we keep supporting the child properly with evidence-based medicine, we keep supporting. If we show that faith, then the parents also come along. The acceptance becomes easier. Just like for maybe autism. If the pediatrician panics, that, oh my God, this is what is happening, and, has a very morose expression and hopelessness around it, then obviously the parents are not going to feel very hopeful. They'll keep fighting that diagnosis. So as a part of their social support system, as part of the society, this is the role that we can play besides being clinicians.
Amruta.
It's very nice, yeah. Very nicely explained, Dr. Armaan. So Dr. Samir was talking about how the teens or the adolescents are getting influenced these days. Now we all know social media is one big influencer. And
Yes.
we do have a lot of transgender influencers on social media, which I know
Yes.
many teenagers are following as well. Do you think it has any impact on them? If yes, is it a positive impact or a negative impact?
Good question.
Absolutely. This phase of life is when a person is exploring their identity in general. Like, this is the phase when a person gains certain autonomy and now they want to know who they are, where do they belong. And during this phase, during our teenage or even early adulthood, a lot of people may question their gender assigned at birth. They may question it. But like I said, dysphoria is very different. Dysphoria, those two criteria are present since puberty at least, and for
Right.
6 months or longer. This exploration is fine. Sometimes patients come to me, young people come to me, and they say that I would like to have I would like you to address me with pronouns they, them, not she, her anymore. And few months later, they're back to, okay, I think I'm she, her, not they, them. And that's fine. It's a phase of exploration, but no desire to change their body permanently.
Right.
Okay. Yeah. And as far as the influence part is concerned, it depends again on the child or the adolescent more than the influencer. Okay, they gravitate
Right.
towards, the influencer also depending on their own personalities, their own needs, their own specific struggles. So I think it's more child dependent than influencer dependent.
Okay. All right.
Yeah.
Very well answered. Samir sir, can I go ahead? Yeah, I think. Okay, so, Pemde, I would like to ask you quickly, if you are having a patient suspected to have a gender dysphoria, do we need to run any test? Do we need to do a karyotype or any other test which need to be done?
Karyotyping is not required, I think. We don't do it. We know what the patient is feeling. And
Any
karyotype will
other
not decide
endocrine
the
test?
gender. Karyotype will not decide the gender. Gender
Right,
is
sir.
feeling and personal identity,
Right, sir.
not decided by the karyotype. Okay, and it's all like other psychiatric diagnosis. This is all how do you understand what the patient is feeling, how they are expressing, what do they want, and accordingly we have to go. Am I right, Armaan?
Yes, absolutely. Absolutely, sir.
So when it comes to therapy, I just want to know when should puberty blockers or any hormone therapy be considered in such cases who are presenting, and at what age, and who takes these decisions? Anyone can answer. Pemde or Armaan sir.
See, as I mentioned that case, such therapies are given around puberty, and indication is only when tenor stage 2 is there. This
Okay.
is a medical timing of the therapy. But before that, you have to assess very stringently that what the patient is, how much is the gender dysphoria, and what the family wants, what the patient wants. And before 18 years, we can do some kind of a temporary treatment where reversal is possible. Okay, so this is the medical treatment which we can do, and many a times we can delay the puberty till the child becomes 18 and can give consent for all those kind of surgeries and permanent sex affirmation therapies. So it has to be begin at the decision is to be taken before puberty and begin at when the tenor stage 2 is there. And various hormonal therapies are there for suppressing puberty. This is just one part of it. Okay. So when you decide to go and have sex affirmation therapy, another part is again hormonal therapy for sex affirmation. So if it was a boy, biological or chromosomical, it is a boy, want to become a girl, you have to give estrogen and other hormones. Similarly, for a sex assigned at birth is girl, want to become a boy, you have to give testosterone and other hormones. So these two ways we have to give the therapy. But yes, experts and specialists should do it. You should always involve endocrinologists or pediatric endocrinologists whenever such things are there. And of course, the psychiatrists and psychologists, because all those documentation is very, very critical and important. You have to keep all those consent and assent thing with you. Then only you give this type of therapy.
Right, sir. Right, sir.
Any,
Very
any
nicely
other
explained.
investigations? Any other investigations, Dr. Armaan?
No, I guess no investigations are per se are required, not by the WPATH criteria anymore. World Professionals Association for Transgender Health. If anyone is interested in understanding more about what is to be done, they have a standard of care. The 8th version is available now, SOC 8. And you can go through that PDF document. It's available free of cost in many different languages. So you can get absolute technical, guidelines from there. And this is what we follow in India also. No specific legal guidelines are in place as of now.
So that reminds me, Dr. Amruta, we have our IAP guidelines as well. You can share
Yes.
it all our viewers.
Published in May 23.
Yes,
Adolescent
yes,
Health
I have it. I will just
published
put it
it.
in the chat
So
box
I'm
in
going
a
to
minute.
combine a couple of questions. Again, Dr. Armaan, pardon me for this, but like Dr. Jayashree Shivalkar has asked, Bollywood is experiencing epidemic of this, isn't it? Is it a trend or real or a place where acceptance is better or attention-seeking behavior or parental neglect? And on the other hand, Dr. Sonu Udani has asked a question, are parents going too far when they refuse to assign gender at birth and say that they want the child to be free to choose? So I definitely feel there are many people who do believe कि ये बहुत ज़्यादा हो रहा है, हम छोड़ रहे हैं ना, कुछ stop नहीं कर रहे हैं, इसलिए ये ज़्यादा बढ़ रहा है. तो how would you answer this?
Well, again, this is very cultural. See, I think every family, every parent has a right to instill their own values in their children, but it should not hamper the physical, mental, sexual development of the child. So, yes, you can say that, okay, I'm assigning the gender to my child as male. But when the child grows up and says that, hey, I don't identify as male, try to be supportive as much as you humanly can. At least not, jeopardize their mental health or physical health further. So I think it's okay to be biased. It's okay to have your own, ideas about certain things. It's okay to have stereotypes. This is normal human conditioning. But don't be problematic to your own kid. That's all. And work with the experts. And experts need to, again, of course, update ourselves. We need to constantly update ourselves about what works, what doesn't work, and help each other out. But the other comment about the Bollywood part and all, I don't think that I can really
I'm going
comment
to
on
ask you
that.
another pointed question. Have you seen that a child comes in and says that I feel I like my identify as a girl and I want to dress like that, and maybe a couple of months or a year later or 2 years later says, I don't feel like that anymore.
Yes, absolutely. That can happen. So first stage actually so we call it as gender affirming medical or surgical treatment. But even before that, what we promote is social transition. So social transition means you appear like the preferred gender, you use their name, you use that pronoun, let other people also call you that. And it need not be done all the time. It can be done in safe environments like just at home, just in my clinic, just with friends. So whatever is safe for that individual. So only after that social, transition has begun at least, and the person feels very comfortable, we go for any kind of medical procedures. So yes, this can happen a lot of times that people have this idea, but no one in their right minds is going to want to change their body permanently unless they have dysphoria. We do have to rule out delusional disorders, psychosis, extreme depression that can also have psychotic symptoms. So that is part of our history taking anyway when a person presents with these complaints. But otherwise, there's no other reason why a person would want to change their secondary sexual characteristics.
Amruta?
Yeah, right. Agree. We can take a few questions in the chat box. They're very interesting questions. I think the audience wants to know.
Yes, Dr. Richa Parashar has asked a good question.
Yeah, I'm just waiting.
What is the question?
So also one question is there, are there any interventions for the subject for parents, for the school or for the teachers to lessen the misery of the child and facilitate his or her growth? This question also, even I would also like to ask this, like, should we include this as a part of school curriculum?
Absolutely. This is part of sexuality education. We need to understand that human sexuality is diverse. It's not just this. We have to
Sex
understand what
education
is
has been
normal.
going on in schools for a long time. I mean, generally they talk about
Namesake.
puberty and yeah, they mostly talk
Namesake.
about puberty, right?
Amrita, I would say this is respecting others,
Right.
respecting others'
As
opinions,
basic as that.
respecting others' behavior. This is that much a very basic thing, and you have to be
Exactly.
non-judgmental. And I
Right.
am really very happy that our new generation is much
Far
more
more.
non-judgmental than us. So this is a
Absolutely.
good change in society, actually.
Far more. So there's a
Absolutely.
question
I
by Dr.
100%
Richa
agree.
Parashar. What if parents don't give consent for change of sex or hormone therapy and a child wants it? Should we counsel parents to go ahead as it is child's wish? Also, do we have to wait till 18 by law, etc.?
See, for permanent changes, yes, we have to wait till 18. Temporary things can be done, and we all understand that consent in a childhood can be given only by the parents before when the child or client is before 18. For many things requiring consent, you have to take the consent. You have to counsel the parents, then only you can do it legally. Otherwise, we can be in a different difficult situations. This is the law of the land we have to follow.
And for the child's mental health, if you feel as a pediatrician that the parents are acting in a way that is deteriorating the child's mental health, please refer the child to a psychiatrist or a therapist so that the child can get that kind of support for their emotional health while they are struggling with their incongruence. So
Right.
you don't have to fight the battle alone.
Right.
Call us.
So I think the referral pathway is always important.
Absolutely.
And timely reference. So we also have a question Dr. Tushar Mania sir wants to know. Now, if like Dr. Pemde sir said, we can use autism or Downs or CP as an analogy in counseling of gender identity. So don't we then run the risk of saying that gender identity is a disease?
Fair question. I think so.
Gender identity is a disease. That is what you are saying.
No.
Yeah, no, he's saying that if we use the autism as an analogy, like somebody wants to cure autism, if you use it as an analogy. So does it imply that gender identity is a disease? I mean, are we looking at a disease, which when it is not? So will it imply that when you are explaining to the parents?
Yes, we have to develop our own system of explaining the things. Okay,
right.
But this is not a disease, definitely. This we have to understand and be comfortable with it. Then only we can explain.
Right.
All right. So, any other questions? Otherwise, we are going to now request our expert who's going to give the pediatrician's point of view, Dr. Preeti Galagali, to come in a few minutes and to give her point of view about the whole thing. But before that, any other questions, please? This will be the.
There was a question about genes and environment and other things. Find some whole exome sequencing, etc. People might like to ask. So whatever research has been done till date, they have not identified any genes or any mutations in our chromosomes or there which can identify these things, gender incongruence. So this is a very, very clear answer. Nothing is very specific about it. Not any environmental toxins found that which can lead to these things. Okay. So their biological etiology, as we are very happy with learning about the etiology, which is not there here. Armaan?
Right, sir.
Yes, as it is for most psychiatric disorders, it's so difficult to understand that part of our brains. So yeah,
Right.
but we know for sure that it is congenital. It's there since birth. Some hormonal factors have been implicated, but that certain androgens, for example, influence the development of the female fetus's brain, and it can get masculinized. So that evidence is there when for trans men, but for trans women, we don't have a similar evidence. But yeah, it's since birth, but we don't know exactly what's the cause, which part of the brain, all of that.
Yeah, we have another question where Dr. Jagruti is asking that do we find that patients who after undergoing medical or surgical transition, do they suffer from depression and inability to accept the sex change? Or is it always a feeling of liberation and elation for the person?
Yeah. So this is called as regret in proper terms. This is called as regret. See, the chances of regret are next to zero. In fact, most studies have shown that the regret chances are 0%. If the transition happens according to WPATH guidelines, if we go stepwise, we do the social transition first, then something reversible like HRT for 6 months, then we do certain surgical changes which are not again genital, leading to infertility permanent. So if we go stepwise, the chances of regret are next to zero. But sometimes people do it without proper medical supervision, or for some other reason, like maybe for commercial reasons or something. And then, of course, they can regret. They can have the regret about the kind of surgery or the surgical results, but not per se for the change.
I think any transition needs a lot of counseling behind it and a lot of effort.
Yeah.
Of course. Samir sir, can we ask Dr. Preeti ma'am now to give her comments? And yeah, I think over to you, Preeti ma'am, now. We have answered almost all the questions in the chat box.
Thank you, Dr. Amruta and Dr. Samir, for inviting me for this very insightful discussion. So all I can say is gender diverse individuals are different, but not less in any way. And our goal as a pediatrician, like for all children, is to ensure health in all its dimensions and ensure that there is good parental bonding, because we know that it is such a strong protective factor. I'm taking an acronym from the AHA guidelines on transgender care, which goes LEARN for all pediatricians. So L stands for learn. Diversity is a norm in the universe, just like biodiversity. Gender is established around 3 years and probably fully established by 5 years of age. L, look at the child, look at the parent, look for the child-adolescent interaction. Another L, listen to the child, listen to the parents. E, educate not only yourself, but also the parent and also the school. Partner with the school, because we know bullying is so very common there and teachers may not accept this child. So the next A is acceptance. Acceptance by us as a society, acceptance by doctors, acceptance by parents, by peers. And we have to do a lot for this, because we are the best advocates for child and adolescent rights. R, share resources with parents, share resources of peer support groups and also parental support groups with parents. Last, I come to N, non-judgmental attitude and safe space is extremely essential for us as pediatricians to offer. And when I come to adolescent care, or for example, even child care, we have these AHA guidelines, in fact, the IAP guidelines. So I would say, please ensure annual health checkups like we would do for any adolescent or any child, focusing on the psychosocial history. Look for depression, anxiety, eating disorders, substance use, self-harm, bullying, cyberbullying. Neurodevelopmental disorders, almost 1 in 3 are seen in gender diverse individuals. So please be on the lookout for that. Sexual history is extremely important. And we ask questions like, are you in an intimate relationship? Gender neutral terms. We don't ask them, do you have a boyfriend or do you have a girlfriend, right? Also, ask for a history of sexually transmitted infections. Extremely important. Ensure that hepatitis B and HPV vaccination are complete, and sexuality education to form safe, happy, healthy, and responsible sexual relationships, irrespective of whether they are gender diverse or not. How to form these relationships, what is consent, what is boundaries, how to protect themselves against sexually transmitted infections, and what is sexual abuse. Always remember that our gender affirming care is multidisciplinary. There is no problem in reaching out to a psychiatrist very early in the treatment. So there is hand holding, and we manage this child together. Something which I may not know, the psychiatrist knows better, and vice versa. So it's a good idea to include them. Always keep listening to the child. Of course, later we would also need an endocrinologist, and we would also need a plastic surgeon. And just as we had in this panel, a multidisciplinary panel consisting of pediatricians, psychiatrists, developmental pediatrician, and adolescent health specialists. So that is the kind of care that we are looking for. To end it all, I'll just quickly share 4 cases in clinical practice. I got a call from a parent of a 3-year-old, and he said, "Doctor, my son, whenever he sees any cloth, it could be a dupatta, it could be a sari, he just wraps it around him and starts walking like a girl. Do you think something is wrong?" So I said, "Okay, anything else?" He said, "This is the only thing which I find abnormal." And I said, "Let us see. There is nothing abnormal in this. Let us observe what happens further." Right? So I think just reassuring the parent and saying there is nothing wrong, keeping the child under observation, having that rapport with the family is extremely important. Another child, just recently, 4-year-old, she had another sib who was born. And after that, she said, "You must all call me Bhaiya. I always want to wear shorts. I want to be just like Papa." So then the mother asked me, is there anything wrong with my child? I said, "Cool down. Nothing is wrong. Let us observe." There is no need to scold her or put her down. If she wants to wear shorts, that's okay, because girls often wear shorts as well. As just what Dr. Armaan said, it is the social construct that we have developed over dressing. An 11-year-old child, whenever he had stress, he would go, and it was an exam, or if he had a tournament, he would go to his mother's wardrobe and wear her undergarments and also wear her clothes. Then again, is my child a transgender, was the question. So I talked to this child. I talked to him about other stress busters. And yes, this behavior stopped, but I'm closely observing him and I'm in touch with him. The last child, 17-year-old, a brilliant girl, I would say, because the sex assigned at birth was boy, but she wanted to be a girl. With a history of fall in academic performance and a lot of anger, she came dressed as a girl with a hairband, with flowery earrings, in a skirt. And she looked at me, and she was assessing me, how would I judge her? But the way we talked and the way the conversation went, she knew much more about the W path guidelines than I did, and she knew about the transgender law much more than I did. The bond that we developed helped me to refer her to a multidisciplinary team at St. John's. And she often says that if it was not for your non-judgmental attitude, I may not be alive because I was thinking of committing suicide. So that is the role that a pediatrician can play. I think we can do a lot, even though we cannot do everything alone. Thank you.
Thank
Very
you so
well said,
much.
Dr.
Yeah,
Preeti.
thank
Very
you
well
so much,
said.
Preeti ma'am. I think those were some really clear and crisp take-home messages with such interesting cases out of your immense experience as an adolescent care specialist. I think
Just
Dr.
one
Samir sir is
comment from
having
my
some
side.
network issues. I don't think we have any further questions in the chat box. I would like to
Just
thank
one
the
comment.
faculty, Dr. Pemde sir, Armaan Pandey sir, and Dr. Preeti ma'am for such an insightful session on such a sensitive topic. Over to Dr. Nehal.
Yeah, so I'll request our treasurer IAP Mumbai, Dr. Jagruti Sanghvi, to please come in and thank everybody today for this wonderful session. Jagruti. Unmute Jagruti. What happened? Okay, I think she's having some problems.
Unable to unmute, I think.
Yeah. Okay. So, on behalf of IAP Mumbai, I extend a heartfelt thanks to our. Okay, Jagruti, yes.
Thank you, Dr. Nehal. I think this was one of the most wonderful sessions that we have had in our monthly Connect program. And as a pediatrician, and I'm sure this echoes with everybody who has attended today, there were a lot of new things and things that we as pediatricians probably were unfamiliar with, and therefore at times felt it didn't really exist in the real world out there. But having met stalwarts today, like Dr. Pemde, Dr. Armaan Pandey, who gave us very crisp ideas, a very non-judgmental approach, explaining us things like, one of the quotes that I remember about gender diverse people or people who identify themselves with the opposite gender is that I'm not just trapped in my body, but I am trapped by other people's perception of my body. And today's talk actually highlighted those aspects. And as pediatricians, I'm sure it is going to make us much more kinder towards our patients who face these kind of issues. And this has been highlighted by the pediatrician's point of view that Dr. Preeti Galagali so nicely summed it up. She mentioned how gender affirmative care refers to a lot of non-judgmental and kind approach towards our patients, and also these patients are no different than any other patients that we come across in practice, and by holding their hands we would go a very, very long way in having a better life for them, and being like how she mentioned about the girl who actually would have otherwise committed suicide. So I think that is the biggest change that we can bring in the life of our patients. And a big kudos to both Dr. Amruta as well as Dr. Samir for handling this issue with so much of sensitivity and bringing to light or highlight the importance of this issue that our teenagers and youngsters can face. So thank you to IAP Mumbai, Dr. Nehal, Dr. Chokhani, Dr. Kasla for giving me this opportunity to give a vote of thanks to. Thank you so much.
Thank you, Dr. Jagruti.
Thank you.
Dr.
Bye-bye. Good
Amruta?
night.
Thank you.
Yes.
Hello.
Amruta.
Sir is back. Yes,
Thank you.
Samir sir.
Yeah, so thanks a lot. Next Wednesday, join us again at Wednesday 9 p.m. for the next episode of Smart Pediatrician. And we are going to have a very, very, very important topic. It's about leveling the playing field for all the lady pediatricians in our profession. So please join us next Wednesday at 9 p.m. We'll share the link with you shortly. Thank you, everybody. Once again, Dr. Harish sir, Dr. Preeti madam, and dear Dr. Armaan, thanks a lot. Thanks, Dr. Amruta, for being such a wonderful moderator and anchor. And thanks, Dr. Nehal, Dr. Jagruti, Dr. Rajesh Kasla, Dr. Rajesh. Chokhani sir, and Shikha. Thank you very much.
Thanks, Dr. Srinivasan sir.
Thank
as
you,
also.
everybody.
Very much.
Thank you.
Bye-bye.
Thank you so much.
Thank you.
Good night.
Good night.